Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear a healthcare practitioner talking about aspects of their work. For questions 31 to 42, choose answer A, B or C, which you think best fits according to the text. Extract 1, question 31 to 36. You hear a Dr. Courtney Stanton delivering a presentation on atherosclerosis. You now have 90 seconds to read questions 31 to 36.
Hello everyone, my name is Dr. Courtney Stanton and today we're going to discuss atherosclerosis. This is a disease in which plaque builds up inside your arteries, the blood vessels that carry oxygen-rich blood to your heart and other parts of your body. Plaque is made up of fat, cholesterol, calcium and other substances found in the blood. Over time, plaque hardens and narrows your arteries. This limits the flow of oxygen-rich blood to your organs and other parts of your body. Atherosclerosis can lead to serious problems including heart attack, stroke or even death. The exact cause of the condition isn't known, however studies show that it is a slow, complex disease that may start in childhood. It develops faster as you age. Atherosclerosis may start when certain lifestyle factors damage the inner layers of the arteries. These factors include smoking, high amounts of certain fats and cholesterol in the blood, high blood pressure, high amounts of sugar in the blood due to insulin resistance or diabetes. Plaque may begin to build up where the arteries are damaged. Over time, plaque hardens and narrows the arteries. Eventually, an area of plaque can rupture or break open. When this happens, blood cell fragments called platelets stick to the site of the injury. They may clump together to form blood clots. Clots narrow the arteries even more, limiting the flow of oxygen-rich blood to your body. Depending on which arteries are affected, blood clots can worsen angina, chest pain, or worse, cause a heart attack or stroke. Researchers continue to look for the causes of atherosclerosis, and they hope to find the answers to such questions as why and how the arteries become damaged, how plaque develops and changes over time, why plaque ruptures and leads to blood clots. They are particularly aware that there are certain risk factors. In fact, many factors place you at risk of atherosclerosis. Some of these risks can be prevented, whilst others cannot. The first risk factor is family history. If atherosclerosis runs in a person's family, then they may be at risk of hardening of the arteries. This condition, as well as other heart-related problems, may be inherited. Lack of exercise. Regular exercise is good for the heart. It keeps the muscles strong and encourages oxygen and blood flow throughout the body. Living a sedentary lifestyle increases your risk of a host of medical conditions, including heart disease. A third risk factor is high blood pressure, which can damage blood vessels by making them weak in some areas. Cholesterol and other substances in the blood may reduce the flexibility of arteries over time. A fourth risk factor is smoking. Smoking tobacco products can damage blood vessels and other areas of the heart. The final risk factor that I'll highlight today is diabetes. People with diabetes tend to have a much higher incidence of coronary artery disease. Most symptoms of atherosclerosis aren't noticeable until a blockage occurs. Common symptoms include chest pain or angina, pain in the leg, arm, and anywhere else that has a blocked artery, shortness of breath, fatigue, confusion, which occurs if the blockage affects the circulation to the brain, and muscle weakness in the legs from lack of circulation. Once a blockage occurs, it's generally there to stay. With medication and lifestyle changes, though, plaque may slow or stop growing. They may even shrink slightly with aggressive treatment. Treatment options include lifestyle changes. Reducing risk factors that lead to atherosclerosis will stop or slow the process. That means a healthy diet, exercise, and no smoking. These changes won't remove blockages, but they are proven to lower the risk of heart attacks and stroke. Medication. Taking drugs for high cholesterol and high blood pressure will slow and may even halt atherosclerosis. They could also lower the risk of heart attack and stroke. Doctors can use invasive techniques to open up blockages from atherosclerosis or go around them. Stenting. Using a thin tube inserted into an artery in the arm or the leg, doctors can get to diseased arteries. Blockages are visible on a live X-ray screen. Angioplasty and stenting can often open up a blocked artery. Stenting helps to reduce the symptoms, although it does not prevent future heart attacks. Bypass surgery. Surgeons harvest a healthy blood vessel, often from the leg or the chest. They use the healthy vessel to go around the blocked segment. These procedures can have complications. They're usually saved for people with significant symptoms or limitations caused by atherosclerosis.
Extract 2. Questions 37 to 42. You hear an interview with Dr. Craig Harrisberg talking about avoidant personality disorder. You now have 90 seconds to read questions 37 to 42.
My name is Dr. Craig Harrisberg, and I'm a mental health professional specializing in psychiatric well-being. My topic today is personality disorders. People with avoidant personality disorder, or APD, have a lifelong pattern of extreme shyness. They also feel inadequate and are hypersensitive to rejection. APD can cause psychiatric symptoms that create serious problems with relationships and work. If you have APD, you might have difficulty interacting in social and work settings. This is because you may fear any of the following: rejection, disapproval, embarrassment, criticism, getting to know new people, intimate relationships, and ridicule. You may also have trouble believing that people like you. When you're sensitive to rejection and criticism, you may misinterpret neutral comments or actions as negative ones. Researchers today don't know what causes avoidant personality disorder, though there are many theories, however, about possible causes. Most professionals subscribe to a biopsychosocial model of causation. That is, the causes are likely due to biological and genetic factors, social factors, such as how a person interacts in their early development with their family and friends and other children, and psychological factors, the individual's personality and temperament, shaped by their environment and learned coping skills to deal with stress. This suggests that no single factor is responsible. Rather, it is the complex and likely intertwined nature of all three factors that are important. If a person has this personality disorder, research suggests that there is a slightly increased risk for this disorder to be passed down to their children. There is no way to know who will develop APD. People who have the disorder are typically very shy as children. However, not every child who is shy goes on to develop the disorder. Likewise, not every adult who is shy has the disorder. If you have APD, your shyness most likely grew as you got older. It may have gotten to the point that you began avoiding other people and certain situations. Your doctor may refer you to a mental health professional who will ask you questions to determine if you have APD. To be diagnosed with APD, your symptoms must begin no later than early adulthood. You must also show at least 4 of the following characteristics. You avoid work activities that involve contact with others. This is due to fear of criticism, disapproval, or rejection. You're unwilling to get involved with other people unless you're sure they will like you. You hold back in relationships because you're afraid you'll be ridiculed or humiliated. The fear of being criticized or rejected in social situations dominates your thoughts. You hold back or completely avoid social situations because you feel inadequate. You think you're inferior to others, unappealing, and inept. You're unlikely to take part in new activities or to take personal risks because you're afraid of embarrassment. Psychotherapy is the most effective treatment for APD. Your therapist may use psychodynamic psychotherapy or cognitive behavioral therapy. The goal of therapy is to help you identify your unconscious beliefs about yourself and how others see you. It also aims to help you function better socially and at work. Psychodynamic psychotherapy. Psychodynamic therapy is a form of talk therapy. It helps you become aware of your unconscious thoughts. It can help you understand how past experiences influence your current behavior. This allows you to examine and resolve past emotional pains and conflicts. Then you can move forward with a healthier outlook about yourself and how others see you. Psychodynamic psychotherapy produces lasting results with benefits that continue after treatment. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is another form of talk therapy. In CBT, a therapist helps you recognize and replace unhealthy beliefs and thought processes. Your therapist will encourage you to examine and test your thoughts and beliefs to see if they have a factual basis. They'll also help you develop alternative, healthier thoughts. Medication. The FDA hasn't approved any medications to treat personality disorders. However, your doctor may prescribe antidepressant medications if you have co-occurring depression or anxiety. People who don't receive treatment for APD may isolate themselves. As a result, they may develop an additional psychiatric disorder, such as depression, agoraphobia, substance abuse problems. Treatment doesn't change your personality. You'll most likely always be shy and have some difficulty with social and work interactions. But treatment can improve your symptoms and help you develop the ability to relate to others.
That is the end of